are going to have some fun tonight, though. There's the topic. We're going to have some laughs, and we're also going to talk about more things than you can imagine. So tonight's message was less is more, and that's everywhere. All of your drugs that are talked about now in medicine, we're telling people to lower their dosages, and it comes with catches. It doesn't mean you shouldn't take these drugs. It doesn't mean you shouldn't take these supplements. It just means be more critical about them, because they all come with catches. But people want to know, how do you live longer? And it's incredible to me that it's right there. Unfortunately, I see plenty of people die young doing everything right, but I also see plenty of people, the majority, live a long life because they followed the probability. So what did these people do that were so remarkable? Well, they did a lot of things in moderation. They did not smoke. Okay, I've heard that. We're not supposed to do that. They had an LDL less than 2.59. They had low cholesterol. They had a normal blood pressure, not slightly elevated. Now, as you go through this list, notice how it's all less is more, really. They had a normal glucose or low glucose level. It's not the sugar you eat, it's your blood sugar. So if you're diabetic or not, it didn't matter. You have to carry a normal blood sugar. Normal waist circumference. Number 5, I'll spend the rest of my life working toward. I mean, these look so easy, but when you start putting them together, they're enormously difficult. Normal mental health stress, what does that mean? That means if you have depression, you should be treated for it, and essentially you should do what you can to boost your mental health, because we're finding out that mental health impacts physical health. Depression kills. Fruits and veggies that came out to a little bit more than a serving a day. Was that pomegranate? No. Was that goji? No. Was that mangosteen? No. Was that noni? No. It was whatever you wanted to eat. That's why I always find it comical when these doctors go on TV too and go, eat the rainbow. I'm going, what? Eat the rainbow? What about the boring fruits and vegetables? What about celery? Well, that counts in this study. You don't have to eat the rainbow. It's just you have to eat consistently healthy in moderation, which is actually not that much. Moderate alcohol. Must have been red wine. No, couldn't identify a type of alcohol that was better than another. Exercise an average of 30 minutes a day. Must have been jumping on a treadmill. No, it actually is whatever you want it to be, as long as it was 30 minutes a day. I can't stand 30 minutes a day. I like an hour every other day. It's just all an average. And you pick what you like. Notice that everyone tells you on television, do this specifically. And what the study really says is, no, do something in general. Just pick what you like as long as you can stay with it. How many people in Canada and the United States can do all 9 of these things on a consistent level over a long period of time? The answer was about 3%. 3%. I think that's actually inaccurate. I think it's more like 1 or 2%. I really do. I think that's the same amongst healthcare professionals. I'll be struggling my whole life to achieve these 9 just consistently on a regular basis. And this should be our primary focus. And tonight we had 128 slides. And out of 128 slides, we talk about all these pills, which are great, but they should all be addressed after you first try to tackle these 9. But listen, I'm going to hang out still, and I just want to say again, I really appreciate you staying late on such a, what I consider a beautiful day here. Thanks.